Gastroesophageal reflux disease, GERD, is a chronic digestive disease. GERD occurs when stomach acid or, occasionally, stomach content flows back into your food pipe, esophagus. The backwash, reflux, irritates the lining of your esophagus and causes GERD. Both acid reflux and heartburn are common digestive conditions that many people experience from time to time. When these signs and symptoms occur at least twice each week or interfere with your daily life, or when your doctor can see damage to your esophagus, you may be diagnosed with GERD. Most people can manage the discomfort of GERD with lifestyle changes and over-the-counter medications. GERD signs and symptoms include a burning sensation in your chest, heartburn, sometimes spreading to your throat, along with a sour taste in your mouth, chest pain, difficulty swallowing, dysphagia, dry cough, hoarseness or sore throat, regurgitation of food or sour liquid, acid reflux, sensation of a lump in your throat.
GERD is caused by frequent acid reflux, the backup of stomach acid or bile into the esophagus. When you swallow, the lower esophageal sphincter, a circular band of muscle around the bottom part of your esophagus, relaxes to allow food and liquid to flow down into your stomach. Then it closes again. However, if this valve relaxes abnormally or weakens, stomach acid can flow back up into your esophagus, causing frequent heartburn. Sometimes this can disrupt your daily life. This constant backwash of acid can irritate the lining of your esophagus, causing it to become inflamed esophagitis. Over time, the inflammation can wear away the esophageal lining, causing complications such as bleeding, esophageal narrowing or Barrett's esophagus, a precancerous condition.
Conditions that can increase your risk of GERD include obesity, bulging of top of stomach up into the diaphragm, hiatal hernia, pregnancy, smoking, dry mouth, asthma, diabetes, delayed stomach emptying, connective tissue disorders, such as scleroderma.
Narrowing of the esophagus, esophageal stricture, damage to cells in the lower esophagus from acid exposure leads to formation of scar tissue. The scar tissue narrows the food pathway, causing difficulty swallowing. An open sore in the esophagus, esophageal ulcer. Stomach acid can severely erode tissues in the esophagus, causing an open sore to form. The esophageal ulcer may bleed, cause pain and make swallowing difficult. Precancerous changes to the esophagus, Barrett's esophagus. In Barrett's esophagus, the tissue lining the lower esophagus changes. These changes are associated with an increased risk of esophageal cancer. The risk of cancer is low, but your doctor will likely recommend regular endoscopy exams to look for early warning signs of esophageal cancer. Diagnosis of GERD is based on your symptoms. Your doctor may be able to diagnose GERD based on frequent heartburn and other symptoms. A test to monitor the amount of acid in your esophagus, ambulatory acid, pH, probe tests use a device to measure acid for 24 hours. The device identifies when, and for how long, stomach acid regurgitates into your esophagus. An X-ray of your upper digestive system, sometimes called a barium swallow or upper GI series. This procedure involves drinking a chalky liquid that coats and fills the inside lining of your digestive tract. Then X-rays are taken of your upper digestive tract. The coating allows your doctor to see a silhouette of your esophagus, stomach and upper intestine, duodenum. A test to measure the movement of the esophagus, esophageal motility testing, manometry, measures movement and pressure in the esophagus. The test involves placing a catheter through your nose and into your esophagus.
Initial treatments to control heartburn. Antacids that neutralize stomach acid. Antacids such as Maalox, Mylanta, Gelusil, Gaviscon, Rolaids and Tums may provide quick relief. Medications to reduce acid production. Called H2 receptor blockers, these medications include cimetidine, Tegamet HB, famotidine, Pepcid, nizatidine, Axid AR, or ranitidine, Zantac. Medications that block acid production and heal the esophagus. Proton pump inhibitors are stronger blockers of acid production than H2 receptor blockers and allow time for damaged esophageal tissue to heal. Over-the-counter proton pump inhibitors include lansoprazole and omeprazole.
If heartburn persists despite initial approaches, your doctor may recommend prescription-strength medications, such as prescription-strength H2 receptor blockers. These include prescription-strength cimetidine, Tagamet, famotidine, Pepcid, nizatidine, Axid, and ranitidine, Zantac, prescription-strength proton pump inhibitors. Prescription-strength proton pump inhibitors include esomeprazole, Nexium, lansoprazole, Prevacid, omeprazole, Prilosec, Zigaide, pantoprazole, Protonix, ribeprazole, Acifex, and dexlansoprazole, Dexilent. Medications to strengthen the lower esophageal sphincter. Baclofen may decrease the frequency of relaxations of the lower esophageal sphincter and therefore decrease gastroesophageal reflux. Surgery to reinforce the lower esophageal sphincter, Nissen fundoplication. This surgery involves tightening the lower esophageal sphincter to prevent reflux by wrapping the very top of the stomach around the outside of the lower esophagus. Surgery to strengthen the lower esophageal sphincter, LINX. The LINX device is a ring of tiny magnetic titanium beads that is wrapped around the junction of the stomach and esophagus. The magnetic attraction between the beads is strong enough to keep the opening between the two close to refluxing acid, but weak enough so that food can pass through it.
Maintain a healthy weight. Excess pounds put pressure on your abdomen, pushing up your stomach and causing acid to back up into your esophagus. Avoid tight-fitting clothing. Clothes that fit tightly around your waist put pressure on your abdomen and the lower esophageal sphincter. Avoid foods and drinks that trigger heartburn. Everyone has specific triggers. Common triggers such as fatty or fried foods, tomato sauce, alcohol, chocolate, mint, garlic, onion, and caffeine may make heartburn worse. Avoid foods you know will trigger your heartburn. Eat smaller meals. Avoid overeating by eating smaller meals. Don't lie down after a meal. Wait at least 3 hours after eating before lying down or going to bed. Elevate the head of your bed. If you regularly experience heartburn at night or while trying to sleep, put gravity to work for you. Place wood or cement blocks under the feet of your bed so that the head end is raised by 6 to 9 inches. Don't smoke. Smoking decreases the lower esophageal sphincter's ability to function properly.